Good afternoon, and welcome to the Sandilands Rehabilitation Center's Psychological Services monthly webinar. Our theme for today's session recognizes the United Nations observance of the International Day Against Drug Abuse and Illicit Trafficking, which occurred exactly 1 month ago. It is not too late, however, to highlight the challenges that the Bahamas, along with the global community, is facing in addressing the problems caused by trafficking, use, and abuse of illicit substances, particularly amidst the ramifications of traumatic and life-changing national, regional, and global events. These include natural disasters like hurricanes, the ongoing COVID-19 pandemic, as well as man-made catastrophes like Russia's war on Ukraine. While nations have been grappling with the health, social, and economic fallout of these events, drug traffickers and suppliers have been finding new and innovative ways to circumvent existing means of detection and target the vulnerable among us. The right to health for all persons, including the more vulnerable, such as children, women, migrants, and other marginalized groups, such as people who use drugs, those with substance use disorders, and those in need of life-saving control medications, is the hallmark of this year's Care in Crisis campaign. And here to bring focused attention to these issues and the importance of presenting a united front in combating these problems are a diverse and dynamic slate of speakers. First, we will begin with opening remarks from Mr. Terrance Fountain. Mr. Fountain is an epidemiologist by training, who has spent over 4 decades in the service of the Bahamas government. He has held such posts as the manager of the National Health Information and Research Division of the Ministry of Health, manager of the National Drug Observatory in the Ministry of National Security, statistical advisor in the Ministry of Finance, where he led the effort to establish the National Statistical System of the Bahamas, and he currently serves as director of the National Anti-Drug Secretariat at the Ministry of National Security. As the director of the Secretariat, he works closely with all agencies involved in drug control and is the country's focal point in drug-related matters for the Caribbean Community Secretariat, or CARICOM, the Inter-American Drug Abuse Control Commission of the Organization of American States, better known as CICAD, the United Nations Office for Drugs and Crime, and the Cooperation Program between Latin America, the Caribbean, and the European Union on Drugs Policies, or COPALAD. He also serves as a guest lecturer in research methodology and as a short-term consultant on health and drug-related research and information systems projects. Take it away, Mr. Fountain.
Thank you, Rochelle. I started to wonder if that was me. But good afternoon to all. And while I am on vacation, it truly is a pleasure to be here. Yes, it would have been most desirable to have hosted this meeting nearer to the actual day, but better late than never. There was a lot going on, and this is the first year in a while that we were able to meet face to face. So there were a lot of meetings taking place around the International Day. First of all, I would like to both congratulate and thank the Psychological Services Department of the Sandilands Rehabilitation Center for contributing to the improvement of knowledge on matters of drug control through consistently hosting these webinars and sharing with the public information on the national situation. This is truly vital if we wish to have any chance of being effective in identifying, addressing the who, the what, the when, the where, and the how, and whether we achieved any measurable impact through our efforts. So thank you, Rochelle, and I trust that these webinars will continue. Just as a bit of history, it was in December of 1987 that the United Nations General Assembly proclaimed June the 26th as International Day Against Drug Abuse and Illicit Trafficking. On this day every year, also known as the World Drug Day, that countries are encouraged to conduct activities to strengthen action and cooperation in achieving a world free of drug abuse. Drug abuse, not drug use. All around the globe, events are held in schools, colleges, workplaces, and public areas to raise awareness of the overall issue, as well as the risk of drugs and their usage. The United Nations, through its anti-drug misuse arm, the United Nations Office on Drugs and Crime, or the UNODC, raises awareness, advises authorities to avoid furthering the narcotics industry, and combats drug trafficking under the cover of legal medicinal enterprises. Given that we are a month away from the actual date, I trust that we all would know that the focus of the International Day Against Drug Abuse and Illicit Trafficking for 2022 was addressing drug challenges in health and humanitarian crisis. If we can just go back to the aftermath of Dorian in 2019, we may recall how important ensuring access to controlled medicines, guaranteeing evidence-based care, treatment and services, and preventing negative coping behaviors through support were to those persons impacted by Dorian. These are among the issues included in the call to action highlighted both on the day, the 26th of June, and in the United Nations Office on Drugs and Crimes World Drug Report 2022, whose main findings were presented on the 27th of June. And if you have not done so, I would encourage you all to familiarize yourselves with the report, as it contains a wealth of information, useful information, no matter what areas of drug control we are working in, and it's available on the internet. Rochelle has given us a great lead and gave us other examples of the kinds of challenges that the theme for this year seeks to address, and I'm not here to repeat that. What I would like to do, though, before I leave, is to remind you that just because the UNODC may have identified specific themes annually that need your attention, this is not a green light to lessen the emphasis on the previous themes that continue to demand our collective actions. As a reminder, in 2019, the UNODC theme for World Drug Day was Health for Justice, Justice for Health, and highlighted the effective responses to the world drug problem. Effective responses to the world drug problem require inclusive and accountable institutions of criminal justice, health, and social services to work hand in hand to provide integrated solutions in line with the International Drug Control Conventions, human rights obligations, and the Sustainable Development Goals. In 2020, the theme was Better Knowledge for Better Care, which demonstrated the need to enhance understanding of the global drug problem and how higher awareness largely supports international cooperation in combating its effect on health, governance, and safety. And in 2021, the theme, Share Drug Facts to Save Lives, aimed to combat misinformation and encourage the exchange of drug facts and practical answers to the current global crisis in order to achieve a scientific vision of health for all, from health hazards to solutions to the global drug problem, to evidence-based prevention, rehabilitation, and aftercare. So with those few words, I wish you a great webinar, and please use the opportunity to question the presenters. Truly, there is no better time to enhance your knowledge than now. So I want to thank you all and have a great webinar. Thank you, Rochelle and guests.
Thank you, Mr. Fountain. And just to our listeners, I just want to remind you that if you have questions or comments, please feel free to post them in the chat as we go along. And our next speaker, our keynote speaker, he will be leaving early. So we will allow some time at the end of his presentation for any questions or comments from the audience. So without further ado, I'll introduce you to our keynote speaker. So he's Dr. Renato Oliveira y Souza. Dr. Oliveira is the unit chief of the Mental Health and Substance Use Unit of the Pan American Health Organization and the WHO. He obtained his medical degree from the Pontifical Catholic University of Sao Paulo in 1995 and a specialist degree in psychiatry from the University of Sao Paulo in 1999. In 2000, he received a postgraduate degree in forensic psychiatry from King's College, London. He also obtained a master's degree in epidemiology from the School of Hygiene and Tropical Medicine in London in 2008. Before starting his duties at PAHO in April of 2020, so right on the cusp of all of the problems with the pandemic, he started with PAHO. He worked as a consultant for the Department of Mental Health and Substance Use at the WHO headquarters in Geneva. We are pleased and happy to have you with us today, Dr. Oliveira. And if I mispronounce any parts of your name, please forgive me, but welcome and please go ahead.
Thank you very much, Rochelle. No, your pronunciation is perfect. Thanks so much for the invitation. It's a pleasure to be with all of you, and it's always great to have the opportunity to talk about treatment and care of substance use problems, especially during the situation that we are facing now with the COVID pandemic. Let me try to share my screen with you. I hope everything goes fine. Okay, so the topic for today is managing health and humanitarian crisis to reduce negative sequelae in vulnerable populations. And we are going to be talking specifically here on substance use and humanitarian emergencies. So just as an introduction in terms of definition, humanitarian emergencies are events or series of events that disrupt and threaten the safety, health, and well-being of populations. They can be caused by different problems, being political conflicts and violence, a very important one, particularly in our region of the Americas with very high homicide and violence rates, hunger and poverty, natural disasters and climate change, a situation where countries in the Caribbean are specifically vulnerable, severe weather events, and now the COVID-19 pandemic as a humanitarian crisis. Humanitarian emergencies and substance use are very closely linked because of a confluence of hazards and threats. We know that humanitarian emergencies can exacerbate the impact on morbidity and mortality. It can also increase the vulnerability of people to alcohol and other substance use disorders, probably causally related to higher levels of distress. And in fact, there is limited knowledge on the association between the exposure to humanitarian emergencies and substance use related harms. There is little research in that area. There is very little in terms of demonstration projects showing how we can address substance use in humanitarian emergencies. So it's an area that it's very important for research, but also important for practice due to the increased number of humanitarian emergencies that our planet faces. And it's important to reflect on why there is an increased risk for substance use disorders in humanitarian settings. And it's logical to think that one reason would be the exposure to potentially traumatic events, adversity, and stress, as I have mentioned. It's well documented that humanitarian emergencies, they increase the prevalence of mental health problems, especially anxiety and depression, which are in turn risk factors for increased use of substances. We know that in humanitarian, in situations of humanitarian crisis, there might be also increased exposure to readily available substances that might not be controlled as they were before the crisis. And humanitarian situations, humanitarian crises also bring situations of potential breakdown of social norms, which also increases the probability of people using substances. In terms of treatment needs and resources for substance use disorders in humanitarian settings, so the reasons that we have described before make us think that the needs increase, although this is not as well documented as it should be. And we also know that in most of humanitarian settings, resources to address those problems, they are scarce. And the little infrastructure that many countries would have before the crisis, they can be overwhelmed to provide sufficient care that the humanitarian crisis might bring in, due to the increased needs. There are many challenges in those situations, and some of the challenges are described here. Depending, and the challenges depend on the type of substances that can be available, which depends on the pattern of substance use in the different regions in our planet, how people use those substances, and also on the existence of specific populations at risk, specific vulnerable groups that might be deteriorating their substance use disorder status or developing substance use disorders. The reality also, and this is a global reality and not particular to humanitarian settings. In fact, the humanitarian crisis will deteriorate further the situation, but we know that there is limited training and capacity on the management of substance use disorders. There is little access to care, and this is also related to the stigma surrounding the topic. A medication for the treatment of substance use disorders, depending on the substance that we would be referring to, some medication could be of an important added value. In many places, there is very little availability of that medication. And in fact, stigma and cultural norms many times also block access to people, and they lead to a situation where there is little help-seeking behavior. So these are some of the challenges that are important to have in mind. There are also other challenges that we need to put into this scenario, which is the many times low political prioritization to the diagnosis and management of substance use disorders, the lack of coordination and integration among the different services and the different levels of services. And when we talk about humanitarian crisis, there is another situation that makes it even more difficult, which is many times the lack of coordination and organization between the different actors addressing the needs that appear after the humanitarian crisis. Humanitarian crises bring different needs. Different needs make us think about how to respond fast with so many priorities. And what we see is that substance use and substance use disorders, it's very rarely prioritized. I already mentioned to you stigma, which can be structural and at the community level, and all the logistical challenges of setting up services or scaling up services in situations of humanitarian crisis. Having said all that, it's important to mention that there are evidence-based interventions that can be delivered in situations of humanitarian crisis. Most of them are not that complex, And if the topic is priority, they could be integrated into the actions that governments and non-governmental institutions deliver in situations of crisis. And some of them I have mentioned here as brief motivational intervention, setting up self-help groups, stress management, social support, strengthening. So these are interventions that are not specific to substance use disorders, but by supporting people in situations of stress, by supporting people in situations of crisis, we expect that they promote mental health and they improve the situation of people with substance use disorders. And also they would try to avoid that people with substance use disorders deteriorate. And we also know that there is a set of interventions that aim to address withdrawal management, being psychosocial interventions, but also psychological interventions that can be helpful and could be in fact crucial in situations of humanitarian crisis, where people who probably had substance use disorders before the crisis are now in a situation of severe withdrawal and could have their needs addressed if those treatments were available. And here I just make a parenthesis because we have interesting data coming from the countries now during the pandemic. 3 times during the pandemic, the WHO and us has sent questionnaires to ministries of health that had in fact 2 objectives. One was to understand how countries were responding to the needs that were caused by the pandemic in terms of mental health and substance use. But the questionnaire had a specific section where we were asking countries to describe how were their essential services functioning during the pandemic. And among those essential services were services for the management of substance use withdrawn, among others. And what we could see while analyzing those questionnaires is that there was, in fact, a very important disruption of those services, which make us think that in moments where probably people need the most, many countries were struggling to maintain services that would help people with substance use disorders. So this is a reason for concern, and we have really highlighted the importance of prioritizing those services during the emergencies, knowing how difficult it might be for many countries. Let me also share with you what is available and that can help countries to address those problems. I mentioned to you that unfortunately, this is a specific area of response to humanitarian crisis where there is very little research and description of models of care. So the evidence that we have is little. So the recommendations that are developed are based on adapting recommendations that come from either high resource settings or non-humanitarian contexts. So it's very important that when those services are integrated into humanitarian responses, monitoring and surveillance mechanisms are also included in a way that we can build up models, understand what works, what is feasible, but also what doesn't work, and we might not need to replicate. There are important principles that need to be incorporated into those interventions, which are principles of working in humanitarian crisis. And some of them are described here as the importance of building trust and engaging with local communities in an area that is so stigmatized as substance use and substance use disorders. This is of utmost importance. Otherwise, even if we create those services during the emergencies, probably we are going to have no one showing up to access care. We need to make sure that stigma is tackled, that programs are multi-sectoral and are not only restricted to health. Dignity and empathy needs to be included as a core component. Ethical principles as do not harm are fundamental, and culture and context need to be prioritized when designing and implementing those types of programs in humanitarian crisis situations. There are gaps in knowledge that we still need to develop research in order to address, which is in fact what are the real needs in terms of substance use disorders and humanitarian crisis, what treatment options might be more relevant, and here the specific focus on feasibility in situations of humanitarian crisis. What types of capacities we need to put in place in those situations. We have been mentioning a lot the importance of task shifting and task sharing in order to be able to address needs in places where human resources are scarce. So I think that's another important area that needs to be properly investigated here. The area of comorbidity, and specifically comorbidity with other mental disorders, but also with physical problems, is very important to be highlighted. And if delivering those services, we need to document how availability is transformed into access and how people are satisfied with services that can be available. Just summarizing here some of the things that we have mentioned in terms of the lack of prioritization at the policy level. Many times there are legal and political constraints that also create obstacles for the delivery of services. I mentioned competing priorities, and many times we have to admit that there is a lot of resistance to evidence-based treatment approaches, like, for example, methadone programs, which are probably rooted in stigma and lack of understanding. I also mentioned to you the lack of availability of skill and resources among professionals and health staff, cultural barriers and stigma. I think it's something that we never get tired of mentioning in the area of substance use, also in the area of mental health. So if we are to design those services in humanitarian crisis, so when we are well prepared for those events, I think it's very important to think about how to integrate substance use disorder services into the preparation for disaster, into the response, and into the rehabilitation component. I think what we want for the present and for the future is that we incorporate substance use disorders thinking into the preparation for the disasters, and in a way that unfortunately when the disaster comes, we are well prepared with the approaches that involve promotion and prevention, but also treatment and rehabilitation. And we don't wait for the rehabilitation phase to create those services that would respond to the needs. In terms of policy recommendations, I believe it goes in line with what I'm mentioning here. We need that governments increase the support to policies to improve access to substance use disorder treatment services in situations of emergencies. We need that the health system is strengthened and prepared to address those needs. We will not advance without, in parallel, tackling the stigma against those conditions. And we need to be aware about the importance of integrating people with those substance use disorders into the thinking of how can we best develop those services in normal situations, but also in situations of emergencies. The views of people with lived experience need to be incorporated into all phases of thinking and implementing substance use disorder services. Let me acknowledge that most of this presentation has been prepared based on a very relevant paper that has been published based on a meeting that was organized by UNODC, WHO, and UNHCR, where most of the things that I have shared here with you have been debated and recommendations blend. So thank you very much for your attention. Again, it's a great pleasure to be here with you today.
Thank you. Thank you so much, Dr. Oliveira. You brought a lot of focus to some of the areas that we need to be paying attention to in terms of being able to provide evidence-based approaches to addressing some of these concerns, but also recognizing that these approaches may not have gone through rigorous testing, and where they did, it may not apply particularly to humanitarian settings. And having said that, recognizing what those gaps are and the need to then adapt and make cultural specific adaptations to the practices. So thank you very much. And again, to remind the audience that we'll take a few minutes here. If there are any questions or comments, persons can either unmute themselves and raise their hands and make a statement or a comment or ask a question, or type in the chat. Do we have any such contribution at this time? So I take it then that there are no questions or comments at this time. If any do appear in the chat, Dr. Oliveira, I'll send it on to you and you can get back to us and we can email it out. So it might be helpful for persons to leave a contact if they have some question that didn't get answered at this time. Thank you very much. We'll move on to our next presenter. So Mrs. Elder Minalee Hanchel. Let me just make sure she's still in the meeting. Sometimes persons drop out because they may be having challenges with connectivity. I don't think I see her in the meeting at this time. So then we'll move to our next presenter, and I'll try to find out what's going on with Ms. Hanchel. So Dr. Carter, I trust that you're ready.
Basden, I can hear you.
Oh, now I see you. Yes. Okay. Okay, good. Okay. Yes, now I see you. Okay. So our next presenter is Elder Minalee Hanchel. Ms. Hanchel is currently serves as the Executive Director of Great Commission Ministries International, a global mission organization headquartered in Nassau, Bahamas. She's a member of the Bahamas Feeding Network and has served on the Bahamas Committee for Families and on the Board of Directors of Hands for Hunger. She's a graduate of the University of the West Indies and the University of Miami and holds a master's degree in education. Elder Hanchel is a noted conference speaker and has ministered in Africa, Southeast Asia, the Caribbean, and the United States of America. She has visited every inhabited island in the Bahamas on mission trips and preaching engagements. She is also the author of 2 books. Her latest book, Holiness Unto the Lord, was recently published. Finally, she's the wife, of Bishop Walter S. Hanchel and mother of 4 adult children. So Ms. Hanchel is uniquely qualified to speak to us on this next topic, addressing challenges in community-based settings. So go ahead, Ms. Hanchel, and help us to shed some light on this topic.
Good afternoon to everyone, and thank you so much for the invitation. Great Commission Ministries was founded in November 1987 by Bishop Walter Hanchel. Ms. Basden, is everything okay? You're hearing me
Yes,
okay?
yes, yes, Ms.
Okay, good.
Hanchel.
Okay. The main areas of Great Commission Ministries are feeding, sheltering, empowerment, youth outreach, and substance abuse program. All of our services are free of charge to our clients. The mission statement of Great Commission is to become a global movement of reconciliation, restoration, and hope for all persons affected by poverty, crime, youth delinquency, small business challenges, and substance abuse. Now, in the area of feeding, this is something that is done daily, reaching out to the community. It's a great need for food, shelter in these areas in our country. Feeding, daily feeding of hot meals. Presently, we serve over 400 hot meals daily. Distribution of grocery packages, delivery of meals to widows, shut-ins, the elderly, and the homeless. 2021 activity report, Great Commission served 118,806 hot meals. Food packages distributed were 80,861. Sheltering. Sheltering is offered for men, women, and children. We provide meals, clothing, and other necessities, group and individual counseling and spiritual guidance in our sheltering, recreational activities, empowerment classes, which include preparation for employment, parenting skills, children's programs, conflict avoidance and resolution classes, to name some of the things done in the shelters. Youth outreach. Meetings are held weekly for children ages 5 to 12. That's called the Children's Club. Weekly meetings for youth ages 13 to 19. That's Teen Aflame. Also, we do practical living teachings, spiritual guidance, recreational and sporting activities, field trips, back to school events, distribution of school supplies, Christmas parties and distribution of gifts, conflict avoidance and resolution, home visitation, counseling, provision of meals, clothing, and other necessities, assistance with homework and job readiness, community service, like for example, persons come to us from the courts for community service that they do at Great Commission, headquarters on Wolf Road, 237 Wolf Road, Nassau, Bahamas. But also we have young people, we encourage them and let them engage in community service, work, therapy, and volunteerism. Our Hope, Restoration, and Substance Abuse Program was established in 1987 as a Bible-based program. The main focus is drug treatment, which includes assessment, treatment, rehabilitation, and empowerment. The duration of the program is 12 months, with clients being allowed to work after 6 months. It is for males 18 years and older. The goals of this program: to provide information, counseling, and the necessary therapy for clients to become free from mind-altering substances, to provide counseling for personal and family problems, to help clients develop positive self-images and good character that results in productive lives, to develop discipline and to promote good working habits, to cultivate positive relationships and teamwork, and to instill positive attitudes, to provide opportunities for wholesome recreational activities, to sensitize clients to the many social needs through community service, to assist with job placement after phase 1 to empower to become productive citizens. Throughout our various programs and community health, the idea is not just handouts, but it's handout. In other words, the focus is to empower persons so that they would not have to be seeking handouts. The drug program, we offer the meals, clothing, other necessities. These are provided for our clients. Some of the activities that are part of the program: group and individual counseling and spiritual guidance, empowerment classes, which include preparation for employment, parenting skills, practical living teachings, things that can help them pertaining to overcoming the depression, and other things that will help them as individuals. Conflict avoidance and resolution classes, not just how to resolve, but how to avoid as well. Recreation activities and outings, job placements and opportunities for starting small businesses, volunteer services in the community. These are some of the activities in the program. As part of our community-based help, the Great Commission Ministries, we help refugees. GCM has accommodated and fed refugees, deportees, and foreigners in crisis from nations such as Nigeria, China, Ghana, Cuba, the Dominican Republic, Sierra Leone, England, United States of America, Egypt, Jamaica, and Haiti, to name some of them. The effects of COVID-19. Due to lockdowns and other restrictions, some of the weekly sessions with counselors and facilitators were placed on hold. There were also financial challenges. We were unable to achieve certain goals efficiently. For example, job placement, starting with small business opportunities because of because we're not able to assemble together, and not the lack of the funding and the means that we wanted to do the teaching and empowerment classes. Some of them had to be put on hold. There were more requirements after during and after the pandemic for potential clients. For example, they had to do the COVID test and mantle test, thus resulting in decrease in numbers. Some persons, when they come, they make up their minds they want to come right then. And so when they have to go another day or to get these tests done, that was a problem and in decrease of numbers. During the pandemic, those who were in the program, the man led by Bishop Hanchel, the founder and president, assisted with the feeding programs at our headquarters. And even during lockdowns, they assisted with delivery to shut-ins, homeless persons, those living in abandoned buildings, derelict vehicles on beaches and bushy areas, because during the lockdowns, we were able, the government allowed us to still be able to serve the many persons who they know were still in need of food. And so we had special letters of permission to go out and to get into some family homes and different ones. So we had our emergency lines rolling all the time, 24/7. And so there were times that help was carried out in that way. The activity report after pandemic, 2019, we had 21 clients. The number of nights spent in the program were 2,106. 2020, were 12 clients. The amount of nights, 2,192. 2021, 14 clients, 2,499 nights. And January to May of this year, January to May 2022, 10 clients, nights, 1,077. And if you kind of look back, just probably three, I can throw out three comparative activity. For example, there were in 2014, there were 45 clients. In 2015, there were 51 clients. 2016, there were 30 clients. As I wrap up, the main needs of our programs, our community health outreach, funding for the construction of a 2-story, 100-bed homeless shelter. There is a great need of persons daily, including today. Calls are coming in of persons, mothers and their children, living in abandoned buildings, living in vehicles. So many who don't have anywhere to stay and reaching out. So there's a great need for homeless shelter. That is it's set at a cost of $3 million. Monies for operational expenses, funding for training, prevention and empowerment programs, groceries, personal care items. Thank you.
Thank you so much, Ms. Hanchel. I can certainly appreciate the importance and the role that your organization plays in this community. And particularly during the pandemic, the Great Commission really stood in the gap, providing care and a hot meal, clothing, a place to stay, spiritual guidance and upliftment for persons at a time when government services was severely interrupted due to all of the health and safety protocols. And I'm sure that your organization was likewise impacted, but you were there nonetheless, meeting the needs of the vulnerable among us. So I thank you. I thank you for your presentation, and I thank you for your organization's contribution to the community. Thank you very much. Okay, so our last and final speaker, but not by no means least, Dr. Carter-Lookie. Okay, it was intentional that you were placed at the end so you could wrap this up and bring this home for us this evening. Okay, so let me first introduce you. So Dr. Novia Carter-Lookie is the director of the Bahamas National Drug Council with the Ministry of Health. She is the immediate past chairperson of the National Child Protection Council for the Ministry of Social Services and Urban Development. She serves as the clinic director of the Children's Advocacy Clinic at the Bahamas Crisis Center. As a school psychologist, Dr. Carter is a scholar practitioner who believes in the importance of empowering young persons. Her lifelong mantra is aligned with Michelangelo's famous quote, "I saw the angel in the marble and carved until I set him free." As such, she continues her service to the education system, working as an adjunct professor at the University of the Bahamas. As an educator psychologist, Dr. Carter-Lookie serves as an agent of change and a child advocate in her community. She's also the proud mother of 3 sons. Dr. Carter-Lookie.
Pleasant good afternoon to you all. Blessings and peace. All right, let's get started. Many times when people hear the term prevention, we always have a tendency to think of the word as meaning, let me stop something before it happens. However, when we look at prevention from a drug perspective, a drug prevention perspective, it has a little different meaning. And so what is it exactly? When we look at prevention, we're thinking about empowering individuals. We're talking about empowering communities, empowering families to meet the challenges of life, but also promoting healthy behaviors and lifestyles. We're trying to help persons understand the importance of not having to use drugs and alcohol to cope. And so let's look at it. What is the goal of substance abuse prevention? Number 1, alcohol use is acceptable for only those who are at a legal age, and only when the risk of adverse consequences is minimal. Secondly, another goal of substance abuse prevention is prescription and over-the-counter drugs are used only for the purpose that they were intended. C, other abusable substances are only used for intended purposes. And finally, when we talk about a goal of drug prevention, we're also looking at illegal drugs and tobacco are not even used at all. And so under this premise, I want you to get a full understanding of why is substance use prevention important? So many people wonder on a daily basis, like what they making noise about, what the problem is, because a lot of people are not looking at the bigger picture. Today, I want to give you the bigger picture. So why is it important? The primary objective of substance use prevention is to help, especially for our adolescent population, to avoid or delay the initiation of psychoactive substances. Or even if someone has already started, our job is to avoid the development of this becoming a dependency. So when are we talking about what is the general aim? Health, safety of our children. The hope that we're going to be able to develop a cadre of young people who can realize their full potential, and that is to be a contributing member of our society. And even though when I talked about the aim of substance abuse prevention, notice I focus on children and youth. That does not mean that substance abuse prevention is not a focus of adulthood. It's just that our young babies are just the focal point of what we do. But we do a lot of work even with the adult population. So what's the role? Healthy communities, healthy families, healthy neighborhoods, and ultimately, of course, a healthy Bahamas. So we want healthy environments, work environments, school environments. We want communities and neighborhoods that support a drug-free lifestyle. We want to help children and persons connect with their families, connect with their friends. But our ultimate goal is to make sure that we all exist in a drug and crime-free Bahamas. So you still don't get what this is all about? Let me help you a little bit further. Our hope is to create a healthy Bahamas. And that healthy Bahamas is going to be really beneficial to all of us because number one, it's going to raise incomes. Two, it's going to increase productivity, not only in the workforce, but even with our children's education. Because our children are going to see the value of education and the value of making a contribution to creating the better Bahamas. And finally, adult well-being. The more healthier we can get our population, the better it's going to look for us in terms of meeting national development, national and international development goals. So let's have a look at it from a public health point of view. And I think this part is so exciting for me because it shows the growth of us as a country. Remember years ago, people would run prevention programs, little programs in their churches, little programs in their community. And for the most part, we stayed away from research. When we look at it from a public health point of view now, as a country, we're moving towards more evidence-based practices. We're moving more towards collaboration, no longer working in silos. From a public health point of view, we're looking at changing populations. So we're not going to hear anymore, this program worked in Fox Hill, are we going to try it in Baintown? No, it's not going to work in Baintown. No, because if you had a program that worked in Fox Hill, we should be able to take what you did in Fox Hill and move it into the Bain and Grandstand communities. And so what are we looking overall when we talk about it from a public health point of view? We're looking at changing lives. We're looking at changing communities, and we're doing it across the lifespan. So even though when I initially talked, I emphasized the importance of us looking at the adolescent population, I want you to realize when we talk about drug prevention, we're talking about all of us playing a critical role in improving communities. It's not just about individuals. We're not just looking at helping the Jones on the street. We're not just looking at helping the office man who goes outside for lunch and has a cocktail. No, we're looking at how are we going to improve our communities so ultimately we could create that healthy Bahamas that we want. So what is it that we do? We look at high-risk populations. And it usually happens during transition points in the lifespan. Think about it for a minute. One of the major areas where I consider it to be of great concern is when we have children moving from grade 6 into grade 7. That's early childhood moving into adolescence. The other big risk factor is going to be that adult now who no longer has to go to work, who may be considered elderly. These transitional points is when a lot of people turn to drugs and alcohol to help them cope. Armed with this information, we look at the bigger picture. And here's the bigger picture. Once again, from a public health point of view, no longer are we just creating programs off the top of our heads. No, we're not doing that. We are looking at the research. We're looking at what are the risk factors? What things in the community could be responsible for someone making a choice to use drugs or alcohol. Look at it from an environmental point of view, all right? Peer influence, a community that is pro-drug use, poor school achievement, poor connection to your school, chaotic home environments, poverty. All of these are environmental factors that could lead someone to try drugs. But let's also look at it from a biological point of view. Notice what I'm saying. Gone are the days where we're just developing programs without looking at the research. The research clearly gives us an idea. What are the risk factors? What would cause a person to use drugs and alcohol? From a biological point of view, could be genetic. From a biological point of view, gender plays a major role. But one of the other major components, mental disorders. Imagine this. When we take these risk factors into consideration, we're now developing programs that have an even better opportunity to work. But we still have to consider the drugs themselves. We have to consider, when did this child first initiate use? We have to identify, and we have to be knowledgeable about what's on the streets in our country and how accessible it is. And so availability plays a major role. Cost plays a major role. How is it administered? And then finally, the effect of the drug itself. And so we have a new day, we have a new day in our country in terms of now we have what I like to call preventologists who are armed with the risk factors, armed with the research, and using a public health model to help get our information out. So what are we preventing? Use. What are we preventing? Misuse. What are we preventing? Abuse. And finally, the biggest one, the bang for the buck, is we're preventing more persons from being addicted to illegal or illicit substances. I just had a thought just now. Remember when I started the presentation, I said years ago, when we heard the word preventing, it meant stopping it before it's starting, preventing someone from using drugs. Now, if you look at this, you see that prevention has taken on even a wider focus in that we are trying to prevent use, misuse, abuse, and finally addiction. So once again, sticking to the research, what are we doing here in the Bahamas? The Institute of Medicine in 1994 developed 3 categories of prevention. And here in the Bahamas, we are in line with what worldwide preventologists are using. We have universal prevention programs, selective prevention programs, and indicated prevention programs. So let's have a look at them really quickly, because I'm sure most of you are familiar with all 3 of the terms. Universal programs. These are the programs that's given to the entire population. Here at the Bahamas National Drug Council, our universal drug prevention program is a life skills program called I Totally Matter. Now, one downfall, and it's always good for us to just be open and honest about it. One of the things in keeping with the public health perspective is I Totally Matter needs to be evaluated. We've done a lot of in-house evaluations, and the purpose of those evaluations was simply for us to say, okay, how can we implement this more effectively? How are people, the facilitators that is, how are they keeping in line with what the program was designed to do? And so we've done a lot of in-house evaluations. This year, we intend to take I Totally Matter to a completely different level, and we really want to have a complete outcome evaluation done of it. And so our universal program is I Totally Matter, designed for the primary school. However, we have been using it in junior high schools as well. Who gets this program? Everyone. Last year, we had almost 2,000 children exposed to I Totally Matter. And I think we got enough feedback that now we could go and have a proper outcome evaluation done, just for us to make sure that, yes, we are accomplishing what we set out to do. What is in our universal program? Remember I said it's a life skills program. So in that program, we teach feelings, managing feelings. We talk about self-esteem. We talk about decision-making. We talk about conflict resolution. We talk about being assertive But the big bang for the buck for me is we help children dream on another level. Because if children start to dream, I totally matter helps them dream because it makes them feel as if I'm too good for drugs. I love myself. I could see where my life is going to go. I'm going to start making plans for my life. And so with that as a foundation, we're feeling really good about the direction that some of our kids are going in. Sadly so, I totally matter isn't enough. And so this year we're moving, we started writing the curriculum year before last, and that's Aspire. Our Aspire curriculum is a selective drug prevention program. This year we're even more excited because we've partnered with the Anglicans to create a selective program for them as well, catering to students in grades 4 to 6. Those curriculums are designed, notice I said selective, for a subgroup, for children who we realize are at risk for substance abuse. Notice when we did the universal program, our universal program doesn't even mention drugs in it, all right? We do no drug education, no drug training in universal. But when it comes to selective, we've already identified that these children are part of a general population that's at risk for substance abuse. And so as a result of that, we're gonna pull those babies out into their own program, and their program caters to their developmental needs, caters to the area that they live in, and it even caters to their age. And so that's the selective program. Once again, in line with international standards, the Bahamas continues to make strides to making sure that we're delivering evidence-based programs and programs that meet international standards. So we're working on those too. Finally, now the indicated program. Those programs are not conducted out of the National Drug Council and instead are conducted out of Sandilands or out of Community Counseling and Assessment Center. All right, and so we just keep strengthening our programs to make sure that we're going to deliver top quality programs that are going to get some results. What does indicated mean? Meaning that these babies need a little bit more help. They're already showing signs of substance abuse. They're already demonstrating problem behaviors, and they need an individual program to cater to their individual needs. And so those are the three types of programs, prevention, intervention programs that are offered here in country. Finally, we come to the prevention strategies. The Center for Substance Abuse Prevention came up with 6 strategies. Once again, y'all, we're not making up our own thing in here in the Bahamas. We're using the strategies that have been indicated to work and those strategies that are supported by our international partners. So here are the 6 strategies. The Bahamas National Drug Council adopts all 6 of these strategies. What do we do for drug prevention? Number 1, information dissemination. All through the year, we had several programs that's designed just to impart information. We did a major campaign, Up in Smoke. Up in Smoke sought to make sure that people understand about vaping. People understand about third-hand smoke. People understand how popcorn lungs are compromised as a result of vaping. We continued our marijuana information sessions. We continued informing persons about edibles. Every time that the National Drug Council was aware of a school that had a problem with edibles on campus, we went in and did our presentations with the Drug Enforcement Unit. Anytime we got a report of a school where either a student was suspended for vaping or someone was caught vaping on property, we made sure that we were in those schools conducting those necessary presentations. Interesting enough, people heard about, and this is just how the whole prevention network goes. When other persons heard about the presentations, then we got invited into Rotary. We did several presentations for Rotary. We were invited into PTA meetings. Even some government ministries invited us in wanting to hear more information. And so for strategy number 1, that's ongoing for the Bahamas National Drug Council, information dissemination. Number 2, prevention, education, skill training. Oh, this was awesome. We did a lot of parenting workshops. We did an online seminar with the guidance department where we did 5 sessions with children online. It was an extremely rewarding, it was just crazy. We had at one point 800 students on Zoom. And so how do I feel? We didn't evaluate it. And that's once again, people, when we talk about stepping up our game, That was, I think, the downfall for it. We didn't do a pre and post test. We simply did a post test of the education skills training. And so everything is developmental. And as we move closer to the public health model, as we move closer to making sure that we're living up to the international standards, this year, hopefully, we're going to make sure that all of our programs have pre and post tests so that we can measure change. And so our prevention education included parent education sessions. We did a lot, we talked a lot about gang involvement. We talked about assertive skills. We talked about just empowering children to be able to stand up for themselves. Of course, we also had to do a lot of work with cyberbullying, you know, all that kind of stuff, because we're trying to change cultures within schools so that children feel accepted, children feel a part. One of the things that we learned over the last 2 years that was obvious with COVID-19 was children need to feel connected to something in order to stay drug-free. And so in many cases we saw over the last 2 years, children who felt as if they were not a part of the school system, they were not a part of their family structures, they were not a part of their neighborhoods. A lot of these children drifted into negative behaviors. And so now going forward, you know, like people like look at COVID and say, oh, COVID was horrible, but you know, it wasn't. I mean, it was, but it wasn't. It wasn't because it still provided us an opportunity to grow and change. It provided us an opportunity to have a look at what are some of the other factors that are playing a role. For step number 2, in terms of strategies, we realized with COVID-19 how important it is for children to feel connected, whether it's to their friends, social organizations, sporting organizations, family, neighborhoods. That's a key prevention step. And so for us, that was an awesome realization. Number 3, alternative activities. It is so important that we provide drug-free programs, that we provide drug-free fun, that we provide drug-free social activities, because many of these children live in environments where drug use is glamorized, where drug use is accepted as a regular part of their lives. And so we sought to develop alternative activities. Interesting enough, the Bahamas National Drug Council has just partnered with JUVERT. And so we're going to be doing some stuff during JUVERT to make sure that our teens, because, you know, I was having a fit to see that alcohol was being sold at a teen activity. And of course, they claim that it's not being sold to teens, but it was interesting to bring him into the office and for us to open up the dialogue to say, how are we going to make sure that we keep more kids drug-free? And so that partnership, we're looking forward to see how that develops as we begin to plan for the next teen activity. Number 4, community-based processes. This one was a little challenge over the last few weeks and months, the last 2 years, basically, with COVID-19, because one of the things that we need to emphasize is the importance of networking and communication. In all government ministries, we exist in silos. And if COVID-19 hasn't taught us anything, it is that the government has limited resources, whether it be financial or physical, especially financial, but government have limited resources. But the interesting thing about it is, if we pool the resources, the skill, the talent that we have in numerous government ministries, it'll be interesting to see what we can do. And so this year, the Bahamas National Drug Council is going to take additional steps for us to pull in our partners, not always to talk about standards. Yeah, but they're important to talk about standards, important, but also for just us to talk about how we're going to improve the prevention arm, the treatment arms of services here in our country. So when I talk about community-based processes, I want you to realize that I'm also talking about mentorship. I'm talking about us networking with our church communities. I'm talking with us networking with parenting organizations. I'm talking about us networking with community organizations, whether it be social organizations, whether it be clubs. We just need to pull together a little tighter to create this safety net that's going to help our children remain drug-free. Point number 5. The 5th step in our prevention strategies, environmental and social policies. Currently, the Bahamas National Drug Council is in our 40-day campaign, One Choice. And our One Choice is where we're putting up labels inside stickers in bars and other places where alcohol products are sold, simply saying to people, just as a reminder, no one under 18 is allowed to buy tobacco and alcohol products. And so we're looking at law enforcement, partnering harder with law enforcement to make sure that we get people to understand how we're going to change the environment. We're going to look at social policies, look at laws to make sure we help more people remain drug-free. And finally, number 6, let's identify those persons who have problems before the problem reaches the addiction stage. Let's refer them to the necessary resources that they need in order to either remain drug-free or to beat addiction. As you look at the 6 prevention strategies, one key thing remains deep in my heart. The Bahamas has always been a resilient nation. We've always managed to pull together to get the job done. My quest to all of you is, let's make sure we pull together for prevention and treatment of substance abuse. Let's pull together to ensure that we deliver evidence-based programs, research-based programs. Remember now, if we have one child, we save one family. We save one family, we build a better community. And if we build more communities that are committed to a drug-free life, that are committed to being the best person I am to create the better Bahamas we want, that's it. We have achieved our goal of becoming the better Bahamas we all desire. So on behalf of the Bahamas National Drug Council, it was indeed my pleasure, because I am looking for the day when all of our children can stand in Rawson Square and shout at the top of their voice their commitment to living a drug-free life. On behalf of the Drug Council, I thank you, and the floor is now open for questions, comments, and your input on what needs to be done to improve prevention in our country. I thank you.
Thank you. Thank you so much, Novia. You certainly brought it home. You hit all the high notes and some low ones, but definitely, definitely you get, I appreciate that broad definition of prevention, as well as introducing us to the variety of universal, selective, and touching on the indicated programs as well. So that was really interesting. And the walkthrough of evidence-based strategies for prevention. And finally, highlighting the need for program evaluation and recognizing that that was a weakness in, or has been so far. But I'm sure you will get that taken care of in short order, and the rest of us will follow suit, hopefully. So thank you very much. You did not disappoint. So now over to the audience. If there are any questions or comments, you can unmute yourself and speak up, or you can type in the chat and someone will read them, and we'll try to speak to your concerns as best we can. So we have a few minutes for that. Novia, you can take down your slide. Good. So while we wait, Mr. Fountain, since you opened us up, do you have anything you might want to add at this point, or just get the conversation going for us, kickstart us?
No, actually, I enjoyed all of the presentations. I know you gave everybody a time limit. Is there anything else that, because of the constraints of time, that persons may have left out that they wanted to share?
Well, that would just be Ms. Hanchel and Dr. Luki, since Dr. Oliveira had to leave. So is there anything that Ms. Hanchel you might have wanted to say, or you, Dr. Luki, that you didn't have time to say because you thought, you're trying to work within the time constraints?
Mm-hmm. Yeah, but while Novia is still not being heard, while we are waiting on Novia to find which of her 3 things she want to speak from. Yeah, no, you know, one of the things I alluded to in the introduction, Rochelle, is again, while the focus, and I'm glad to hear that Novia did some of this, but while the focus is on this year's theme, that has to be looked at in relation to or along with the themes from the other years. So when we're talking about conducting programs, we want to make sure that we're not wasting anybody's money nor our effort or time. And so we need to make sure that our goals and objectives are clear. We need to make sure that we measure the impact of what it is that we're doing to see whether or not we're achieving those goals and objectives, which was better data for better something. I think that might have been 2020. I think last year was, again, addressing this whole concept of misinformation and also including that disinformation. There's just too much of it going around. Of course, we saw a lot more of it last year with respect to COVID. Yeah, we saw a lot more of it last year with respect to COVID and that relationship between COVID and drugs, access to things. And so again, we just need to make sure that as we move forward, and if we think about what you all had to do as a result of Dorian, you go down to Abaco, there's no electricity, no this, no that, no clinic. What could we have done better? In a situation like that, I think when you all do your initial assessment, are you still collecting data? How can we improve on all of these in hindsight? And so again, as we do what we do, regardless of the situation we face, when we face with these, whether it's environmental or man-made disasters, are we still doing the things that we're supposed to be doing to ensure that at the end of it all, we can show that our effort was worth it? So that would be my last 5 cents.
Novia, you had a comment earlier when you were muted.
No, ma'am, I agree with Mr. Fountain. I agree.
Okay. Yeah, and I particularly liked this year's focus on the humanitarian settings, particularly as we were just coming out of the Dorian experience just before being hit with the pandemic. And there were studies that were going on at that time, looking at what was happening in some of the settings where people were I guess they were refugees to an extent, but the misplaced people, I think that was the terminology used for misplaced persons, and whether or not there were concerns related to substance use. And so it was, I guess, for us, kind of a novel concept because we had never had that kind of situation to that extent in the past. But when you think about it, we do have similar situations just on a smaller scale. We have situations like the one that we're just being confronted with this week with the migrants and the shipwreck and situations like that. So there are times when there are large numbers of survivors from situations like that, and they're displaced for a while. Or even if we think about our detention center, like how much attention do we give to what's happening at our detention center as it relates to substance use? And so I think it just kind of opens up our minds to think a little bit outside of the box and not just about the normal run-of-the-mill things that we encounter on a daily basis and that we deal with year in, year out. But what about these other areas over here that we may forget about or we may not focus on as much? So I think it's just about broadening the mind and looking outside of, the blinders. So, Ms. Hanchel, any final comments from you? Unmute.
Yes, I really appreciate the the information and being here, and so I'll WhatsApp you to get some requests to get some of the information. Yes.
Yes, and we certainly appreciate your participation. We try each year when we do this to include someone from the NGO community. And so I think this might have been the first year that that your organization was represented. But I know I thought a lot about your organization during those early days of the pandemic when access was so hindered out of necessity, of course, but nonetheless, the problem still develop as a result of that. And so I thought of the role of your organizations and a few others that were on the news quite often, showing the extent to which you were there for persons in need in the community. Come rain or shine, your doors are open, and you try to meet the needs as best you can without discrimination. Thank you.
Thank you.
Okay, so unless I missed something in the chat, we have just a few thank yous. Thank you for today's session. It was amazing and really informative from Jose Luis. Thank you, Jose Luis. Thank you for today's session from Renato. Thank you for today's session. Yeah, I read that one. Okay. It was well put together and very informative. I look forward to future sessions like this. Yeah, so thank you for those comments. Okay. So yeah, our department, we try to do a monthly webinar. This started since COVID-19, and with a few exceptions, we have been living up to that commitment. And so yes, we'll certainly let you know when we're having our next one. It's usually the fourth Tuesday of every month, but we had to do it differently this month to be able to accommodate all the speakers, and because we were trying to catch up from last month as well. So we'll let you know. Stay tuned. Look forward to seeing you next time. Thank you.
I just wanted to say hello to Fiona all the way from Antigua. It's a pleasure seeing you, even though I can't see you. But it was really awesome to see that international partners. So excellent job. Hi, Fee.
I think Fiona is trying to let you see her.
All right. Thank you.
Yes, yes. In fact, whoever wants to turn on their camera, you can do that at this time. So we could take a look at each other.
No, nobody wants it.
Nobody else. Okay. Okay, yeah. But I share that excitement, Novia, when you see people and be like, oh, hey, hi. Yeah.
Okay, take care, everybody.
Okay.
I have to go buy some shop, something.
You on vacation.
Yeah.
Jose Luis, you are not shy with the camera. Stop it.
Bye-bye.
Right.
Okay. All right. Thanks everybody for coming.
Okay.
See you next time.